Healthcare has always been good at adapting to changing conditions and being able to find solutions to today's problems. One technology that is being used to meet these demands is telemedicine, providing efficient, cost effective care to an ever increasing older population with multiple chronic conditions is why telemedicine has been in higher demand. This paper looks at telemedicine as a solution for healthcare organizations needing alternative methods to provide physician services and the importance of data quality in telemedicine. ABC Healthcare is an acute care hospital located in an area where there's competition among hospitals to attract bigger market share by introducing newer cutting edge technologies. ABC Healthcare is currently undergoing a large expansion project and will need to recruit new physicians and replace retiring physicians. The problem with physician recruitment is that the region has high malpractice insurance costs, little progress in tort reform measures, and low reimbursement rates, which are driving the physicians away from the area. Hospital and board members have decided to look to alternative methods like telemedicine to provide physician coverage for radiology, intensivist, and behavioral health crisis intervention services. Telemedicine makes patient interaction easier without having to be in the same physical location through the use of technology. This is especially useful for those in areas where specialists are difficult to access or those who cannot travel. Telemedicine is a cost effective and efficient way for medical organizations to provide quality services and increase patient satisfaction. Risk analysis strategy. HIPAA security rule mandates that organizations evaluate risk and vulnerabilities in their environments and to implement reasonable and appropriate security measures to protect against reasonably anticipated threats or hazards to the security or integrity of EPHI. Health and Human Services outline the process in which some organizations might undertake to perform risk analysis. 1. Scope of the analysis. All potential risks and vulnerabilities are identified along with availability and confidentiality of PHI that the organization either creates, keeps, or sends. PHI can come from network computers, laptops, flash drives, emails, DVDs, portable devices, etc. Accessing accessing all areas that organization utilizes or encounters PHI is a difficult and utilizes PHI is a difficult challenge to ascertain but necessary in order to perform a risk analysis. Data collection. The locations where PHI are stored, received, and sent must be identified. Relevant data can be collected looking at past projects, current projects, interviews, checking documentation, and using other data collection methods. The data collected should be documented. Identify and document potential threats and vulnerabilities. Organizations should be able to anticipate threats to PHI and document their existence. Not all threats are universally the same to each organization. Some will be unique to the conditions in which that organization operates. They must also be able to document what would occur if a vulnerability was exploited and how that would affect inappropriate access to PHI. Employees should have access to a compliance hotline to empower staff to identify and resolve privacy issues prior to them becoming HIPAA breaches. Assess current security measures. The current security plan should be assessed to see which elements of the security rule are in place, what safeguards are used, and if those elements are used correctly. All safeguards should be documented as part of the security rule. Determine the likeliness of threat occurrence. Reasonably anticipated threats are those threats that the organization took into account as a potential risk to PHI. Those threats require protection. The combination of all threats with the possibility they may impact PHI should be documented. Determine the potential impact of threat occurrence. The organization should take into consideration what the result would be if the worst case scenario occurred and caused inappropriate access to PHI. Risk analysis would predict the impact of a threat succeeding and exploiting a vulnerability. Threats with potential impact should be recorded. Determine the level of risk. All risks and vulnerabilities should be assigned a level of risk. The higher the chance of occurrence, the higher the resulting impact, the higher the level of risk. Corrective measures should be assigned to the risk to lessen the risk level. Finalize documentation, periodic review, and updates. Documentation is a requirement of the security rule. Risk analysis is a continuous process. Although there is no actual requirement as to when the risk analysis needs to be updated, this will probably vary depending on their environment. When an organization plans on implementing a new technology, security incident or new management, they might try to assess possible risks to ensure protection of PHI. Assessing healthcare decision-making models. System development life cycle. The System Development Life Cycle, SDLC, is the planning, designing, implementing, and evaluating a healthcare information system. The planning stage is that the ABC Healthcare is a hospital that is financially doing well in the market and is undergoing a $57 million construction and renovation project. Will be looking to hire new physicians to accommodate the growth, along with replacing physicians that are retiring. The caveat is that the region the hospital is in has high malpractice insurance costs, lack of tort reform, and low insurance reimbursement rates, making it physician unfriendly. The design phase will take into account the need for high-speed web connections and cloud-based services so seamless real-time connections can be obtained. A cost-benefit analysis was performed and a vendor was chosen and negotiations finalized. The implementation phase will include workflow studies, system install and testing, staff training, and preparation for go live. The evaluation phase makes sure that the resources are appropriately allocated, glitches fixed, and the system is running with little downtime. How technology impacts cultural factors and provisions in decision making. In order for organizations to compete in today's market, they need to seize opportunities and take risks to continually improve. The natural reaction for most people when faced with change is to have some level of fear and apprehension. Change, change in the workplace can lead to fear of the unknown, increasing workload, and loss of employment. The amount of change perceived by the individual is proportional to the level of resistance and how that individual handles change. Managing people at work means try to control factors that affect their work quality and quality of life. According to Joelmana Goncalves, organizational change needs 6 features: intelligible to facilitate communication and understanding, logic to create a reference for those working in the organization, explicit to avoid ambiguity in terms of relationships, flexible to motivate people to deal with unexpected problems and take advantage of unforeseen opportunities, structured from strong principles that lead to stability and at the same time add value to work for the organization to become competitive. Understanding the culture of the organization is important to understand prior to implementing change. A climate of trust needs to be established so the employees realize that there is no threat to their job or position and maintain transparency. Employers need to give the project time and allow the changes to occur gradually. They should be flexible in making modifications where necessary. One solution to eliminate resistance to a health information system adoption is to bring in key members from different clinical areas to be part of the steering committee in the system acquisition process. Involving leaders from various areas from the beginning helps them to feel as though they're part of the process and solution. They'll be vested in the process of the project and talk positively with coworkers about it. Anyone who will be impacted by the new system should have the opportunity to have a voice in its selection. Focus groups, vendor presentations, and site visits are all good ways to involve other staff members who will be impacted and not on the steering committee. The opportunity to have a voice in its selection. Focus groups, vendor presentations, and site visits are all good ways to involve other staff members who will be impacted and not on the steering committee. Roles and responsibilities of key players in policy, strategies, and challenges. IT department. The IT department is responsible for the development and management of the architectural plan and making sure that IT supports that plan. They must also create a process to maintain IT standards in areas such as telecommunications protocols, client devices, server technologies, data definitions, disaster and recovery plans, and security policies and procedures. They ensure that individual and organizational information systems are reliable, secure, efficient, current, and supportable. IT users. The IT users must understand the scope and quality of the IT projects their area is supporting. They must ensure the goals of the IT projects meet the needs of the organization and resources required are realistic. They must make sure there is constant feedback provided to the IT organization on any issue regarding performance. IT users should occasionally check the accuracy of reports and that passwords are deleted when employees resign or are terminated. Senior management. According to Wager, Lee, and Glazier, senior management makes sure the organization has a complete, thorough IT strategy. They also establish budget, IT applications, and infrastructure. Senior management makes sure IT purchases and applications and activities are all in accordance with policies and regulations. They should also review any new IT opportunities and look into emerging IT opportunities. The board. The board is accountable for the organization's performance, which also includes IT performance. The board should receive periodic updates, which include IT agenda, risk mitigation, and issues that affect IT use. The IT budget is reviewed by the Finance Committee. Enterprise-wide data's role in health information governance. IT governance is composed of the processes, reporting relationships, roles, and committees that an organization develops to make sure about the processes, reporting relationships. Processes, reporting relationships, roles, and committees that an organization develops to make decisions about IT resources and activities and to manage the execution of those decisions. These decisions involve issues such as setting priorities, determining budgets, defining project management approaches, and addressing IT problems. Governance is responsible for making decisions in IT strategy development, prioritization and budgeting, project management and architecture, and infrastructure management. With the increase of need for establishing standards, organizations have identified the importance of governance for using information technology. IT governance is used as a tool to align IT strategies with overall business strategies. As a result, organizations look for tailor-made IT governance models and not off-the-shelf solutions. A successful information governance implementation is dependent on the time, focus, and success of organizational change management. Organizational change management looks at an organization's culture and potential to accept the changes necessary to implement an information governance organization. An information governance process means that those who previously were in charge, the stakeholders and executives, and were responsible for budgets and had certain authorities, will defer those resources to another organization. Furthermore, they now must use that organization for something that they already had, all for the betterment of the organization. Organizational change management helps to reboot executives into buying into the information governance process. The new information governance organization should provide time and cost savings in any new projects the executives are looking to invest in. Change management required for sustaining an information governance organization includes strategies, training plans, and continuous data stewardship teaching. Challenges for organizational change are found at executive, operational, and project levels. They all involve levels of engagement for implementation and interaction with the stakeholders who may need assurance on the investment of an information governance system. Big data analytics can have huge impact for many business sectors, including healthcare. However, there are some limitations that need to be overcome. 3 limitations are data structure issues, security issues, and storage transfers. Data structure issues. Applications for big data need to be transparent, user-friendly, and menu-driven. Most of the healthcare data is fragmented and not standardized, which makes it difficult to analyze. This is a major cause of why EHRs lack interoperability. Data capture has been very inconsistent. Providers have documented clinical findings whichever way has been easiest for them, with no regards how this data could eventually be collected and analyzed. EMRs attempt to make this data capture process standardized, but providers are hesitant to follow this one-size-fits-all approach. This results in data that is difficult to analyze in a consistent manner. As providers give in to this more structured approach to entering data and EMRs improve and become more user-friendly, there will be better data for analytics. Security issues. Organizations need to protect personal health information, and the more locations that PHI exists along with duplicated data adds opportunity for data loss or breach from those places. HIPAA allows for HCOs to request written authorization from the patients to disclose the data in ways needed for analysis. They may include outsourcing the data or third-party involvement, which increases the risk of data breach. Organizations need to determine which data loss or misuse would cause regulatory or litigation risk and reputational harm. Storage and transfers. The storage and transfer of data is much more expensive than generating data. Costs occur when moving data from one place to another, and then data analysis. Structured data is easier to store and analyze, while unstructured data is not as easy and more costly. Cloud and flash storage have become viable options with added security and nearly constant uptime rates. Big data can improve patient quality of care, help manage population health and early detection of disease, among other possibilities. Healthcare is pushing for more data and analysis of that data to increase quality and revenue. If opportunities of data are realized, they can change patient outcomes and how decisions are made by physicians. Improve quality of care. Big data can predict outcomes using primary historical data and also show proof that established standards of care can be changed. Outcomes and quality of life can be improved with increasing the amount of technology available to the patient and helping the patient be compliant with taking their medication regularly. By reducing waste of information, which in turn will reduce inefficiencies, quality of care will be improved. Quality can also be improved by reducing the rates of readmissions, increasing operational efficiencies, and improving performance. Managing population health. Big data not only helps manage individual health, but also population health locally or globally. Socioeconomic data and social determinants of health information form a rich pool of information about population health. EHRs need to be designed to pull out more of that information from the patient and collect it in a structured format to allow for easier analysis. Early detection of disease. Improved treatments and better outcomes are associated with early detection of disease from big data. In addition, analytics help prevent deadly illnesses and management and monitoring of disease. Healthy behaviors can be tracked and helps patients monitor their conditions. This is a great potential for this capability in age-related diseases. Economic impact of telemedicine. Organizations are always searching for ways to decrease healthcare spending without affecting access, effectiveness, and safety. Telemedicine is one such technology that can offer those benefits. Three methods for economic evaluation are cost analysis, cost effective, decrease healthcare spending without affecting access, effectiveness, and safety. Telemedicine is one such technology that can offer those benefits. Three methods for economic evaluation are cost analysis, cost effectiveness analysis, and benefit cost analysis. Benefit cost analysis compares the cost with economic benefit to determine if the program is economically justified and better than other programs and is a more comprehensive way to evaluate economic outcomes. There are some research gaps, limitations, and challenges in the economic evaluation of telemedicine programs. These include limited generalizability, disparate estimation methods, few complicated BCAs, lack of randomized controlled trials, lack of long-term evaluation studies, and small sample sizes. The economic cost of benefit will vary according to whose perspective is examined, either the patient, provider, or stakeholder. Costs associated with telemedicine for the patient are time, employment or leisure, and medical costs. Provider costs are equipment, depreciation, facilities, maintenance, wages, training, and telecommunication costs. Other stakeholder costs are costs to the taxpayer from expanded coverage for telemedicine services in Medicare, Medicaid, and private insurers, and loss of productivity because of workers' participation in the program. Economic benefits associated with telemedicine for the patient are increased medical effectiveness, increased earnings from not losing time from work, increased access to health care, faster diagnosis, reduced waiting times, increased medication adherence, and decreased travel. Provider benefits include reduced length of stay, less emergency room visits, less readmissions, avoided laboratory tests, increase patient satisfaction, increase productivity, avoid referrals, and decrease travel time for home visits. Benefits for other stakeholders include increased worker productivity, less cases of communicable disease, and more efficient access to health care for special groups like prisoners. The full range of economic benefits to telemedicine is difficult to analyze since they are hard to quantify monetarily. This also makes comparison to other programs a complicated decision. Board questions and replies. What safeguards would be implemented to keep PHI secure and for the organization to be HIPAA compliant? Although the thought of simply having a channel of communication between a patient and provider seems like an easy solution for the problems faced at ABC Healthcare, there's much more needed to comply with HIPAA guidelines. Elements that are necessary for HIPAA compliance specific to telemedicine are only authorized users should have PHI access, implementation of secure communication to protect PHI, and a system to monitor communications to prevent security breaches. Reasonable safeguards should be put in place to prevent external threats. Systems used for communication need to be monitored and can be remotely deleted if a threat is detected. Business Associate Agreement, BAA, is needed for a third party if they store data, which will describe the methods used to protect data and how audits are performed. Secure messaging with password protection and temporary browser sessions are ways in which the integrity of the PHI is protected. Question 2. In telemedicine, does secure messaging impose an unnecessary level of risk to the patient? Since healthcare is always evolving, many organizations are looking into secure messaging or texting platforms. Providers need effective ways to communicate that do not compromise PHI. Mobile technologies are a great opportunity to make coworker communications more effective, which could reduce the possibility of errors that could affect patient care. Vendors need to overcome usability issues with their messaging products. One way PHI is protected is by receiving system compromise PHI. Mobile technologies are a great opportunity to make coworker communications more effective, which could reduce the possibility of errors that could affect patient care. Vendors need to overcome usability issues with their messaging products. One way PHI is protected is by the receiving system prevents the forwarding of behavioral health and substance abuse treatment or anything required by state and federal laws. Since this is yet another way in which PHI is transmitted electronically, it can potentially put the patient's PHI at risk. The benefit of instant, effective communication far outweigh the PHI risks and could help improve patient outcomes. Question 3. What are any potential obstacles that prevent the implementation of telemedicine at all areas of the United States? Connectivity issues, especially in rural areas, are still an obstacle for telemedicine to reach its full potential in the United States. Some rural areas do not have high quality broadband access needed to be connected to telemedicine providers. The reason for rural areas not having broadband availability is due to a lack of competition to provide fiber to those areas, leaving the rural areas with lag in quality compared to urban areas. This causes a secondary effect that affects telemedicine implementation because clinicians do not have extra time to wait out slow technology, and their frustration will cause them to quickly return to their old ways of practicing medicine. One way to improve connectivity is to convert white spaces, unused frequencies left by the loss of analog TV, into wireless broadband internet access. This would need to be passed through the Federal Communications Commission, or the FCC, for approval, which has already proposed increasing its broadband spending limits to increase telemedicine in rural areas. Greater broadband connection for larger rural healthcare providers would lessen the demand for more bandwidth, which in turn would lower costs, resulting in more resources to be reinvested in patient care. Connect Americans Now is a group of businesses, which includes Microsoft, that are working with the FCC to make sure there are enough unlicensed low-band spectrum in all areas to provide broadband connectivity. Telemedicine provides an alternative for healthcare organizations like ABC Healthcare that need physician services for specific areas like radiology, intensivist, and behavioral health crisis intervention. Telemedicine is expected to continue to grow annually, and although it has some limitations, healthcare providers are looking to solve those issues to improve patients' access to quality care. Although there is limited data on cost effectiveness, there are many benefits that are envisaged. Like enhanced access to care, reduced healthcare costs, better patient care quality, and increased patient engagement. There are many benefits that are envisaged, like enhanced access to care, reduced healthcare costs, better patient care quality, and increased patient engagement. References: care organizations like ABC Healthcare that need physician services for specific areas like radiology, intensivists, and behavioral health crisis intervention. Telemedicine is expected to continue to grow annually, and although it has some limitations, healthcare providers are looking to solve those issues to improve patients' access to quality care. Although there is limited data on cost effectiveness, there are many benefits that are envisaged, like enhanced access to care, reduced healthcare costs, better patient care quality, and increased patient engagement. For healthcare organizations like ABC Healthcare that need physician services for specific areas like radiology, intensivists, and behavioral health crisis intervention. Telemedicine is expected to grow annually, and although it has some limitations, healthcare providers are looking to solve those issues to improve patients' access to quality care. Although there is limited data on cost effectiveness, there are many benefits that are envisaged, like enhanced access to care, reduced healthcare costs, better patient care quality, and increased patient engagement. It's a group of businesses, which include Microsoft, that are working with the FCC to make sure there are enough unlicensed low band spectrum in all areas to provide broadband connectivity. Telemedicine provides an alternative for healthcare organizations like ABC Healthcare that need physician services for specific areas like radiology, intensivists, and behavioral health crisis intervention. Telemedicine is expected to continue to grow annually, and although it has some limitations, healthcare providers are looking to solve those issues to improve patients' access to quality care. Although there is limited data on cost effectiveness, there are many benefits that are envisaged, like enhanced access to care, reduced healthcare costs, better patient care quality, and increased patient engagement.